Hello, I'm Miles Hassell. I practice internal medicine and lifestyle medicine at Providence St. Vincent Hospital and Medical Center in Portland, Oregon. I wanted to talk a little bit about red meat because so many patients come in with questions, should they eat red meat or shouldn't they eat red meat? And the confusion is understandable because the comments in the medical literature are quite contradictory. So how do we make sense out of this? First of all, let's back up and just remember that red meat has been ubiquitous throughout most human civilizations for the entire recorded history of mankind. So it has a long history of use. Then we have the fact that red meat is a powerhouse of nutrition. Protein, B vitamins, iron, zinc. This is a pattern of nutrition that really is not present anywhere else. And many of us like red meat. And many people comment that they feel better when they eat red meat. So what do the data show? We certainly have studies showing that red meat is harmful to health. There's many of those studies. But interpreting them is quite difficult, and that's because of a number of reasons. First of all, actually defining what red meat is difficult. For example, if your red meat is a hamburger from a fast food place with fries and a shake, I think most of us would appreciate that that's dramatically different than stir-fried vegetables with hamburger at home. They're both starting with ground meat, but the results are quite different, and we could use numerous examples like that. Another problem is that preserved meats tend to have a pretty strong record of being harmful to health, and it's very hard for patients in these observational trials to define whether they're really eating a preserved meat or a fresh meat, and that is an incredibly important confounding factor. The third confounding factor, and this is fascinating, is that people who eat a lot of red meat often make very, very poor health choices otherwise. Sedentary, smoking, too much alcohol, obese. And if we look at those factors, if we look at people who are healthy who eat red meat, those people seem to be able to eat any amount of red meat and not have any adverse health consequences from it. So appreciating the why there's so much contradictory data out there is important. Now, what I've referred to so far has been observational data, and that's the data that's highly contradictory. Now let's look at randomized controlled trials where red meat is a factor. One study called the BOLD study took people on a good diet and they randomized them to different levels of red meat. So the highest level of red meat that people were eating was actually 5 ounces of red meat per day. In the people who had the most red meat consumption, they actually had lower cardiovascular risk factors and lower levels of inflammation measured. Then we have Shai's study where she looked at obese people, and for 2 years she gave them either an Atkins style diet or a Mediterranean style diet, both of which had more red meat, or a low fat diet with much less red meat and saturated fat, and measured them their success over 2 years. In those that had the higher levels of red meat, the Mediterranean diet and the Atkins diet, both of those had better heart disease risk factors, more weight loss, despite the fact that they had more meat, more saturated fat, and more cholesterol in their diet. So we have this range of studies, observational studies that are highly contradictory, randomized controlled trials, and history that really strongly supports moderate amounts of red meat in your diet. I would recommend that the American Institute for Cancer Research recommendations of up to about 1.5 pounds measured raw weight of red meat a week is probably a very reasonable goal or maximum. That there's a strong case, I think, that can be made for using grass-fed meats instead of feedlot, both for humanity reasons in terms of how they're raised as well as nutritional qualities. And I think another case could be made for saying, watch out for preserved meats. Preserved meats do have a stronger association with poor health. Finally, don't forget the basics of a good diet. Avoid sugars and refined flours. It's the refined carbohydrates that are your biggest enemy. Make sure your diet is based on fruits and vegetables and whole grains and beans, to which you add meat. Make sure that you consider fish more important than red meat in your diet, because the data are much stronger. And of course, poultry is an excellent food as well. Thank you.